Hello, I'm here today in our endoscopy department, and I wanted to be here because they've just had their accreditation visit, which happens every few years, and they did so well as a unit. They've been commended by the accreditation team, which included experts who work in other organisations who come and look at our systems, our processes, the way we manage patient care and our patients' experience. We haven't yet received the final report, but I'm sure that it's going to be excellent, so well done to everybody in endoscopy. There are about 40 staff who work in here, and they see 50 patients every single day, which is some going. Endoscopy, for anybody who doesn't understand it, is the use of small vessels to have a look inside into internal organs, usually either down one way or up another way. Many of you watching this probably have had an endoscopy, and you will know just how good our staff are at keeping you confident, calm throughout the whole procedure. So thank you so much to them and to all of you for supporting us in the endoscopy department. You've heard me talk in previous podcasts, but accident and emergency services continue to be a real challenge to us and to most other hospitals in England. Unfortunately, we've had some really very difficult days recently, which has meant that we've had to give patients a longer than expected experience in terms of their stay in accident emergency. We still get good feedback from our patients, and that's thanks to the incredibly professional staff who are still managing to care for them through what is a difficult time for very vulnerable patients. We actually have at times seen so many frail, often elderly patients who have had to be admitted that we've been seeing nearly 300 patients a day and admitting about 36% of those patients. Something we want to work more with primary care to ensure wherever possible we can prevent those people becoming so acutely ill they need hospital, all the better to keep looking after them in the community. And talking about community services, it's a very fond farewell and a sad farewell to about 700 of our Tameside and Glossop community staff. They've been with us since 2011, and we've been on a real journey with them. But it's now time for them to go and work much more closely with Tameside Foundation Trust and the Council and primary care in the Tameside and Glossop area, to eventually become part of an integrated care organisation. We wish them the very, very best for the future. I know that their skills, their professionalism and their expertise will only give bonus to the integrated care work that's already been started in Tameside and Glossop. I'm very proud of them and what they've done for us over the years, and I wish them the best in the future. Another of our areas of challenge, and we acknowledge that, is parking on the Stepping Hill site. And so what we're trying to do, because there just are not enough spaces for everybody, is to encourage both our staff but also patients and visitors who are coming onto the hospital to use alternative means of transport. That might be anything from being dropped off by a friend or neighbour, or using one of the buses. We've got bus services that come in from the High Peak and also from Manchester and on the Hazel Grove side of the hospital. Indeed, there's a park and ride scheme now opened in Hazel Grove, which is just an 8-minute journey away by bus, and the buses go past the park and ride every 10 minutes. So it might be a less stressful way for you to actually make visits to the hospital. And I'll ensure that on the podcast we actually give you information around how to actually find that car park and the charging rates for that. There's going to be quite a few changes at board level and senior management level. And we've got a new medical director because of the retirement of James Catania, our medical director, after 14 years in the post. And first of all, I just want to say thank you to James, who has been fabulous as a medical director. A hard act to follow, but I think we've got a good successor in Dr. Colin Wasson. Colin is an anaesthetist. He's been here since 2002, and has worked as a clinical manager, not only just for anaesthetics but also for surgery and critical care. And I'm sure that he, in his role, will be a huge benefit to all of us in giving good medical clinical advice to the board and others making important decisions. Joining him is a Deputy Medical Director, which is a new post for us, and that has just gone as an appointment to Dr. Jill Burrows. Jill Burrows is a clinical pathologist, and she's been with the organisation for 17 years, also working in clinical management capacity as a clinical director for pathology, but more recently she's been managing as Associate Medical Director for the Clinical and Diagnostics Business Group and also for the Child and Family Business Group. The two of them will ensure that we've got a robust, resilient, full-time cover as Medical Director, and they will be starting in post soon, and we look forward to welcoming them. It's a goodbye, however, to a board member who has been with us a significant number of years. Carol Prowse, who has been our Deputy Chair, and she's also been our Senior Independent Director. We wish Carol all the very best going forward, and I thank her for her compassion and care, always having the patient at the centre of everything that she does. You will recall that we were selected as one of 4 specialist surgical sites under the Healthier Together programme, and although nothing visible has changed yet, certainly in terms of patients, we are still planning for the changes. In fact, those might occur as early as April 2017. Just to recall, this is where we will be undertaking the acute abdominal surgery and some high-risk planned surgery as well at Stepping Hill site, and that will be not only on behalf of Stockport patients and the High Peak, but also looking to Tameside and Glossop patients and East Cheshire patients. So we will be the specialist hub with the spokes working out as a single way of working for the people of that wider catchment. And we are another first. There are 2 centres in Greater Manchester giving advanced trauma life support training, and we're working with Salford to actually provide the important training that is needed for people who are within the first hour of sustaining a major trauma. That programme has been approved by the Royal College of Surgeons, and we're commencing that work to ensure that not only our practitioners but others across Greater Manchester can receive the very best in terms of educational training to ensure they give the best possible care. We've got some other shortlistings that I wanted to mention. So we've got well done to Dominique White and Sarah Haywood, who are both nurses on our short stay surgical unit, and they're finalists in the Mentors of the Year award. We've also got a Community Placement of the Year finalist, and that's the Stockport Intermediate Care Team. I wish all of them the very, very best, and know that even if they haven't won, they're absolute winners for us and our organisation. And finally, we now have taken charge in Greater Manchester. Greater Manchester Devolution has started properly. We've been working for a year in shadow form, and this is where health and social care, both commissioners and providers, have worked together to ensure that we create a strategy that means for the people of Greater Manchester, they will have, over the next 5 years, changes put in place to improve their life expectancy, to improve wellness. So this isn't just about trying to cure ill health, it is about keeping people healthy. And even then, it's not just about health and social care. What we need to do is actually look at how we can have better education. We can have better working arrangements, more people in jobs, because that avoids poverty. We also hope to have better housing, to have better transport systems to allow people to move to take those jobs. Greater Manchester Devolution is incredibly exciting. It's not without huge risks and responsibilities. We are going to be responsible for £6 billion of money, ensuring that that is spent in the way that makes sense for Greater Manchester and the population here. The huge responsibility is also to find £2 billion of savings. We believe we can do that by reducing duplication, by improving efficiencies and spending money in the right places instead of expensive areas because people have fallen ill just because we've not been able to work with them earlier to make sure that they can maintain their health in their homes. Very exciting, and I'm sure in future podcasts we'll be talking more about the changes that are coming about as a result of taking charge.